Question 31. Among the following, which client is autotransfusion possible? A. Client with AIDS. B. Client with ruptured bowel. C. Client who is in danger of cardiac arrest. D. Client with wound and infection. Correct answer, C. Autotransfusion is acceptable for the client who is in danger of cardiac arrest. Question 32. Which of the following is not a sign of thromboembolism? A. Edema. B. Swelling. C. Redness. D. Coolness. Correct answer, D. The client with thromboembolism does not have coolness. Question 33. Nurse Becky is caring for client who begins to experience seizure while in bed. Which action should the nurse implement to prevent aspiration? A. Position the client on the side with head flexed forward. B. Elevate the head. C. Use tongue depressor between teeth. D. Loosen restrictive clothing. Correct answer, A. Positioning the client on one side with head flexed forward allows the tongue to fall forward and facilitates drainage secretions, therefore prevents aspiration. Question 34. A client has undergone bone biopsy. Which nursing action should the nurse provide after the procedure? A. Administer analgesics via M. B. Monitor vital signs. C. Monitor the site for bleeding, swelling and hematoma formation. D. Keep area in neutral position. Correct answer, C. Nursing care after bone biopsy includes close monitoring of the punctured side for bleeding, swelling and hematoma formation. Question 35. A client is suffering from low back pain. Which of the following exercises will strengthen the lower back muscle of the client? A. Tennis. B. Basketball. C. Diving. D. Swimming. Correct answer, D. Walking and swimming are very helpful in strengthening back muscles for the client suffering from lower back pain. Question 36. A client with peptic ulcer is being assessed by the nurse for gastrointestinal perforation. The nurse should monitor for A. Plus, Guay-Ix stool test. B. Slow, strong pulse. C. Sudden, severe abdominal pain. D. Increased bowel sounds. Correct answer, C. Sudden, severe abdominal pain is the most indicative sign of perforation. When perforation of an ulcer occurs, the nurse may be unable to hear bowel sounds at all. Question 37. A client has undergone surgery for retinal detachment. Which of the following goals should be prioritized? A. Prevent an increase in intraocular pressure. B. Alleviate pain. C. Maintain darkened room. D. Promote low-sodium diet. Correct answer, A. After surgery to correct the detached retina, prevention of increased intraocular pressure is the priority goal. Question 38. A client with glaucoma has been prescribed with miotics. The nurse is aware that miotics is for A. Constricting pupil. B. Relaxing ciliary muscle. C. constricting intraocular vessel. D. Paralyzing ciliary muscle. Correct answer, A. Miotic agent constricts the pupil and contracts ciliary muscle. These effects widen the filtration angle and permit increased outflow of aqueous humor. Question 39. When suctioning an unconscious client, which nursing intervention should the nurse prioritize in maintaining cerebral perfusion? A. Administer diuretics. B. Administer analgesics. C. Provide hygiene. D. Hyperoxygenate before and after suctioning. Correct answer, D. It is a priority to hyperoxygenate the client before and after suctioning to prevent hypoxia and to maintain cerebral perfusion. Question 40. When discussing breathing exercises with a postoperative client, Nurse Hazel should include which of the following teaching? A. Short frequent breaths. B. Exhale with mouth open. C. Exercise twice a day. D. Place hand on the abdomen and feel it rise. Correct answer, D. Abdominal breathing improves lungs expansion. Question 41. Louie, with burns over 35% of the body, complains of chilling. In promoting the client's comfort, the nurse should: A. Maintain room humidity below 40%. B. Place top sheet on the client. C. Limit the occurrence of drafts. D. Keep room temperature at 80 degrees. Correct answer, C. A client with burns is very sensitive to temperature changes because heat is lost in the burn areas. Question 42. Nurse Trish is aware that temporary heterograft, pig skin, is used to treat burns because this graft will: A. Relieve pain and promote rapid epithelialization. B. Be sutured in place for better adherence. C. Debride necrotic epithelium. D. Concurrently used with topical antimicrobials. Correct answer, A. The graft covers the nerve endings, which reduces pain and provides framework for granulation. Question 43. Mark has multiple abrasions and a laceration to the trunk and all four extremities. Says, "I can't eat all of this food." The food that the nurse should suggest to be eaten first should be: A. Meatloaf and coffee. B. Meatloaf and strawberries. C. Tomato soup and apple pie. D. Tomato soup and buttered bread. Correct answer, B. Meat provides proteins and the fruit proteins vitamin C that both promote wound healing. Question 44. Tony returns from surgery with permanent colostomy. During the first 24 hours the colostomy does not drain. The nurse should be aware that: A. Proper functioning of nasogastric suction. B. Pre-surgical decrease in fluid intake. C. Absence of gastrointestinal motility. D. Intestinal edema following surgery. Correct answer, C. This is primarily caused by the trauma of intestinal manipulation and the depressive effects anesthetics and analgesics. Question 45. When teaching a client about the signs of colorectal cancer, Nurse Trish stresses that the most common complaint of persons with colorectal cancer is: A. Abdominal pain. B. Hemorrhoids. C. Change in caliber of stools. D. Change in bowel habits. Correct answer, D. Constipation, diarrhea, and/or constipation alternating with diarrhea are the most common symptoms of colorectal cancer. Question 46. Louie develops peritonitis and sepsis after surgical repair of ruptures diverticulum. The nurse in charge should expect an assessment of the client to reveal A. Tachycardia. B. Abdominal rigidity. C. Bradycardia. D. Increased bowel sounds. Correct answer, B. With increased intra-abdominal pressure, the abdominal wall will become tender and rigid. Question 47. Immediately after liver biopsy, the client is placed on the right side. The nurse is aware that this position should be maintained because it will A. Help stop bleeding if any occurs. B. Reduce the fluid trapped in the biliary ducts. C. Position with greatest comfort. D. Promote circulating blood volume. Correct answer, A. Pressure applied in the puncture site indicates that a biliary vessel was punctured, which is a common complication after liver biopsy. Question 48. Tony has diagnosed with hepatitis A. The information from the health history that is most likely linked to hepatitis A is A. Exposed with arsenic compounds at work. B. Working as local plumber. C. Working at hemodialysis clinic. D. Dishwasher in restaurants. Correct answer, B. Hepatitis A is primarily spread via fecal-oral route. Sewage-polluted water may harbor the virus. Question 49. Nurse Trish is aware that the laboratory test result that most likely would indicate acute pancreatitis is an elevated A. Serum bilirubin level. B. Serum amylase level. C. Potassium level. D. Sodium level. Correct answer, B. Amylase concentration is high in the pancreas and is elevated in the serum when the pancreas becomes acutely inflamed, and also it distinguishes pancreatitis from other acute abdominal problems. Question 50. Dr. Marquez orders serum electrolytes. To determine the effect of persistent vomiting, Nurse Trish should be most concerned with monitoring the A. Chloride and sodium levels. B. Phosphate and calcium levels. C. Protein and magnesium levels. D. Sulfate and bicarbonate levels. Correct answer, A. Sodium, which is concerned with the regulation of extracellular fluid volume. It is lost with vomiting. Chloride, which balances cations in the extracellular compartments, is also lost with vomiting, because sodium and chloride are parallel electrolytes. Hyponatremia will accompany.